Bowel assessment is one of your skill station in NMC OSCE. What about this? It is a silent writing station. What do I mean? It does mean that it's going to be your pen and a paper that will be doing the talking. Not going to demonstrate, you're not going to demonstrate any skill whatsoever here, and you're not going to use any PPE. No consent, no privacy, nothing. Just going to. This Bowel assessment, what it means basically is you are going to be assessing your patients, their bowel movements. And this could come in two forms. It's either it is constipation or diarrhea. However, just like the chart you're seeing on the screen, this chart is called Bristol chart. All right. So Bristol chart is just to assess the patient's bowel movement, which is in like about seven kind of stool as you're seeing on the screen. So in the exam, it's either it is type 1 or 2 or 6 and 7. So all of those middle figures, it's not that they don't matter in the real clinical setting, but for the purpose of your exam, it is only 4 out of the 7 that will be dealt with. What happens if your patient is having constipation? It's either the picture is going to be pictorial illustration, mind you, in your exam. It's not going to be real stool. This chart that you are seeing here is this form is going to come in this form. What you do basically on this form is to identify the type of stool and tick it. Then your initial, you can skip this place, say the size of the stool or something. But if your scenario states that the bowel has been opened, bowel open or not open, you will act accordingly. That's basically what you're going to do on this chart. So where the real writing lies is, it is depending on the scenario that is painted for you. If they tell you the patient is having constipation or diarrhea, it is either diarrhea or constipation in your exam. Yeah, you cannot be confused. It is either the stool is like apart, separated and like this, or sausage like and kind of rough edges or something, just like this type 2, or it is watery with some lump, or so it's entirely watery, like in case of type 7. So it's either it is this way. What will you do? For a patient who is having constipation now, the first thing you're going to do is you will identify the cause of the constipation. And in this case, it could be anything according to your scenario, but you and I know that the major culprit for constipation is opioid. That is the medication. It could be any reason at all. All right. It could be due to dietary intake. All right. So whatever your scenario suggests is what you're going to, but firstly, you're going to identify the cause of the constipation. Secondly, you are going to advise whosoever. It is important, if the name is mentioned in your scenario, in all of your care plan, you need to put the patient's name. All right. Secondly, you're going to advise the patient to increase his or her fluid intake. Thirdly, you will advise the patient on the increase of their mobility if your scenario is presenting that. Next point is you need to advise the patient on his or her dietary intake to include more fruits and vegetable, also fiber-rich food, as this will promote bowel movement. Next point is you should advise the patient to assume standard correct posture while toileting. And if the use of bedpan is involved, that you are going to support the backs with pillow and make the patient to be as comfortable as possible. Next point is you need to state that you will ensure that dignity is provided at all times, especially regarding the use of toilets. Another point is you need to say that you will encourage the patient not to resist the urge to defecate at any point in time. Yes, because when they tend to hold back, like they stay back when there is urge to defecate, there will be further reabsorption in the rectum. The final thing you would want to say is you will propose a laxative to be prescribed by the physician for your patient. Most of these points you're going to write here in the case of this patient having diarrhea is almost opposite to what you wrote earlier. However, not all. So the first point is you will still identify the cause of diarrhea, which could be medication. Medications such as antibiotics could cause patients to have diarrhea. Also, overflow. Overflow in the sense that the patient that has been having constipation for some time, if they are not properly taken care of, there can be the solid and liquid part of the stool can be formed. Okay, that's overflow. So the liquid part of the solid resulting from the constipated patient, the liquid part now is the overflow. Food poisoning is another good reason why a patient could be having diarrhea. Also, dietary changes. Having identified the likely cause of the diarrhea, next thing you're going to do is following the universal standard precautional measure, such as the use of appropriate PPE to curtail the spread, because until the cause of the diarrhea is properly established, probably after having taken stool sample to the lab, all diarrhea should be treated as so as they are infected. So you need to be on safer side, and in order not to transfer this from one patient to another, a precaution measure should be put to place. Another point is rehydration is key. These patients can be prone to dehydration. You should write, you will rehydrate the patient. You should obtain stool sample and send to the laboratory for investigation. And if indicated, if the findings indicate that the stool is infected, the point you should write is you should advise this patient to stop any dietary intake that can promote bowel movement, such as fruit, vegetable, or fiber-rich food, pending the time the diarrhea gets resolved. Another point you should write is you will maintain the integrity of the skin around the patient's perianal region at all times. All right, wiping with soft wipes and patting it dry in the same manner. Another point you should write is you would ensure close access to toilets. Finally, on that note, you need to state that you will continually reassess the patient until the diarrhea is resolved. Also, this point is applicable to the previous one, that's constipation. You need to continually reassess the patient until the constipation is resolved also. I hope you've learned something, and this is basically it. To do well in this station, you need to write at least 6 points, 6 good points. And this point we've mentioned in this video is enough to make you pass the station. See you again in my subsequent videos, and until then, keep practicing OSCE. Bye bye.